Good morning, everyone. Thank you for joining us today for the State of Workplace Mental Health, our third Health Links webinar of 2023. We're honored to have you all here today, and May is Mental Health Awareness Month. You may have been seeing a lot of conversations about mental health come up in your social media feeds and your news feeds, and for the last 3 years, we've been having a webinar dedicated to workplace mental health called the State of Workplace Mental Health in May each year. So thank you for joining us for this 2023 edition of that content. My name is David Shapiro. I am a white male joining you from my home office in Denver, Colorado. My Zoom background today is a black screen with the Health Links logo in gray and white. I'm wearing a blue button-down shirt and glasses, and my pronouns are he, him. I am the Senior Manager of Programs and Partnerships at the Center for Health, Work, and Environment. We are one of 10 Centers for Total Worker Health funded by the National Institute for Occupational Safety and Health, or NIOSH, at the CDC. We get to work with employers of every size and in every industry on their commitment to workplace health, safety, and well-being. And certainly since the start of the pandemic, and even before that, workplace mental health has been a really important topic that we've talked with organizations about, especially as it relates to the overall health, safety, and well-being of employees. And so we're honored to have you all here participating with us today on this webinar, again, on workplace mental health. A few housekeeping items. For those of you that have not used the chat yet to tell us where you're from, please chime in and let us know where you're joining from. We've been honored to have participation from almost all 50 states in 2022, as well as 15 countries in several continents. So it's always great to see all of you joining us from so many different places. So please use the chat function to tell us where you're from. Also, chat will be the place to troubleshoot any technology issues that you may be having. So that would be the place to put any technology issues you're having. We're going to use Q&A on the Zoom toolbar to ask questions of our speakers and panelists. So if you happen to post a question on the chat function, our team will ask you to move that over to the Q&A section of your Zoom toolbar, because that's where we can all see the questions and vote them with a thumbs up. If somebody is asking the same question as you or in the same way, we don't need to have you repeat typing it. You can just use the thumbs up to vote it up the list, and we'll have time for Q&A with our speakers at the end of the webinar as well. There is a survey at the end of this webinar that usually pops up directly for people, but that survey is pretty important for two reasons. One, we really appreciate your feedback as a university. We are at the Colorado School of Public Health, and we appreciate feedback on our webinar series. But also for those of you that are claiming continuing education credits, we know we have a lot of individuals in the CHES space that are joining us today. You'll need to complete that survey in order to have CHES credit issued. So make sure to stay tuned for the pop-up of the survey, or we'll put it in the chat towards the end of the webinar as well. This webinar is being recorded, so you will receive a recording of it, as well as if there's any slides with data and presentation on them that you might need as part of that follow-up as well. One caveat on that I want to mention, we have some staff vacation time coming up, and so that follow-up email, which normally goes out in the 48 hours after the webinar, is going to come to you next week. So give us a little bit of time and grace and patience as we work to get out the follow-up email, but that will be coming early next week with the recording of today's webinar. And finally, for those of you that need closed captioning, that is an option on your Zoom toolbar, and please follow Zoom instructions in order to access the closed captioning content. We always start with a land acknowledgement, and I'm going to read that here for us today. So as we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government, and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm these ties that nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native people. So today's webinar, we have a keynote speaker, and then we have a discussion with a few panelists to provide some context to those remarks. And then we will have a Q&A section with all of the speakers. So be thinking about what questions you might have of our speakers. And as I mentioned, please use the Q&A section for any questions that come up during the presentation. We'll try to get to as many of those as possible. So it's my honor to introduce our first speaker today, Craig Kramer. Craig is a mental health ambassador and as co-chair of the United Nations affiliated Mental Health Innovation Working Group and the United States National Action Alliance for Suicide Prevention. Previously, up until December of 2022, Craig was mental health ambassador for Johnson & Johnson, the world's largest comprehensive healthcare company. Craig chaired Johnson & Johnson's global campaign for mental health, which worked with partners around the world to transform mental health care by raising awareness, reducing stigma, promoting research, improving access, and ensuring better patient outcomes. The key initiatives included an international advocacy network, a global fund for research, and a world leaders coalition to champion proven, scalable reforms, including next-in-class workplace mental health practices. And prior to this role, Craig held a variety of positions in global corporate and government affairs at Johnson & Johnson and worked as a lawyer in the U.S. Congress, a Washington, D.C. law firm, and an international human rights organization. Craig is a graduate of Princeton University School of Public and International Affairs and University of Michigan Law School and Harvard Business School. He serves as a board member with mental health nonprofits like Project HEAL for eating disorders, DMACS Foundation for college students, Trinity Counseling Service for the uninsured, Mental Health Center of Denver's Well Power for community and criminal justice services, and On Our Sleeves for children and families. So thank you, Craig, for joining us today and talking to us a little bit about your own personal experience and what we should think about when we talk about workplace mental health.
Thank you, David, and hello, everyone. I am a 62-year-old white male with thinning gray hair, wearing a white shirt and a blue blazer. From Michigan originally. I see a lot of my Michigander friends on the line here, and currently speaking to you from my home office in Denver, Colorado. I am speaking to you today because of a phone call I got on New Year's Day a couple of years ago from my daughter, Catherine. And I answered the phone and said, "Hey, Catherine, how's it going? Happy New Year." Because, you know, I'm one of those dorky dads. And a man's voice came on the phone. Now, I knew my wife had been on my daughter had been on a first date the night before. So this was awkward a little bit, right? And the guy said, "Are you Catherine's father?" And I'm, yes, I am. And then the man said, "This is the Boston Police Department. Your daughter tried to kill herself. We're taking her to the hospital. You need to get up here right away." And as we drove from New Jersey up to Boston, we thought about our daughter's 10-year struggle with an eating disorder, of pediatricians and primary care doctors who knew little or nothing about mental health, of waiting months to see a psychiatrist or a specialist, only to find out that they didn't have what we needed. And more often than not, they were not following evidence-based best practices. We thought about fights with the insurance companies to get basic services covered here in the United States. We thought about how we felt alone because the advocacy and the research communities are fragmented and underfunded and therefore relatively ineffectual. And we thought mostly about the sheer exhaustion of going to bed every night, wondering if our daughter was going to be alive in the morning, and then having to drag ourselves to work and try to perform at a high level when we were really distracted and trying to think of other ways to help our daughter. We later found out that this dysfunction applies not just to eating disorders, but to all kinds of mental health issues: depression, anxiety, addiction, postpartum, post-traumatic, OCD, bipolar, schizophrenia. And it's not just our country, the United States. The World Health Organization now says that when it comes to mental health, every country is a developing country. At the time, I was vice president of government affairs for the global healthcare company Johnson & Johnson. And I was meeting with health ministers and finance ministers and hospital CEOs and doctors and patient groups. And I started to talk to them about mental health, and I confirmed that, in fact, no country does this well. I had been working at that time on cancer, HIV, diabetes, infant and maternal mortality, really the healthcare issues of our time. And I thought that I might be able to do something about mental health. I knew that our company spent about 5% of our research on mental health, neuroscience. And I thought that was probably commensurate with the size of the challenge. I also thought, because we don't talk about it enough, that my family was just uniquely unlucky. And so this was a sort of a manageable problem. I could do this in my spare time. And I went to the head of our neuroscience research division, Dr. Hussaini Manji, a Canadian. And I said, Hussaini, I have this strange skill set. I work to build global coalitions to transform health systems and lead to better outcomes for, a variety of health issues. And I'd like to, work with you to try to do something on mental health. How hard can it be? And Hussaini, like I say, he's Canadian, so he's very nice. He didn't laugh at me. He didn't yell at me. He just very kindly said, well, here's some reading. Go read these materials. Get some background on the problem. And what Hussaini taught me and the reading taught me really blew me away. It turns out that mental health is really, by almost any measure, the healthcare challenge of our time. Mental illness is the leading cause of disability worldwide. The World Economic Forum says that in the coming decades, mental health will account for over half of the economic burden of all chronic illnesses. Let me say that again. It's more than half of all chronic illnesses. So the other illnesses I mentioned, diabetes, cancer, I didn't mention cardiovascular. Mental illness is half of that overall economic burden. That's not just the healthcare cost, because frankly, we don't spend enough on mental health. It's the cost to the economy in terms of disability, in terms of productivity, in terms of lost sick leave and lost lives. In fact, the burden of mental illness is bigger than the combination of cancer, diabetes, and chronic respiratory diseases like asthma and COPD. Now, when I heard that, I thought, well, how can that be? Well, it turns out that mental illness is a lot more common than we think. 1 out of 4 people, 1 out of 4 of us will have a diagnosable mental illness at some point in our lives. And many of us are adjacent to mental illness at different times of the day or the week or the month or the year. I think we've all learned this during COVID, that we all have mental health. And depending on the stressors and the traumas that we experience, we can move from mental well-being into mental distress and into mental disease, right? And we can also move back, thankfully. But it's more common than we think. It's also the only chronic disease of the young. The other diseases I mentioned happen later in life, and so they have a lesser impact on our economic and health systems. But half of all mental illness begins by the age of 14. And another 25%, so 75% of all mental illness begins by the age of 24. And because most people around the world do not get any treatment, only 1/3 of people get treatment, and most of them, like my daughter, it takes 8 to 10 years before they stumble into some kind of effective mental health care. And so the economic cost of mental illness piles up over entire lifetimes into the trillions of dollars. And this impact is being amplified by our continuing evolution into a knowledge-based economy around the world. When I was growing up in Detroit, you could get a good paying job down at the big 3 auto companies, often performing repetitive physical tasks. Those jobs are all automated now. And almost any job you have, whether it's working at McDonald's like I did when I started my career, or working at an aerospace company, we all need enough cognitive function to collaborate and innovate. Really the two hallmarks of our 21st century global economy. And so we're starting to see the effects in our headlines. It may be hard to remember before the pandemic, but just before the pandemic, here in the United States, our life expectancy declined 3 years in a row. That decline has continued because of COVID, but even before COVID, we were on a downward trend. The last time that happened was 100 years ago. So this was reversing 100 years of progress. And 100 years ago, we went down because of World War I and the 1918 flu, the last pandemic. So that was the scale of what we were already experiencing here in the United States before the pandemic. But this time, the cause was the preventable outcomes of mental illness, suicide and drug and alcohol overdose. And then if you look out beyond the United States, you will find similarly shocking statistics. And the one that really called out to me was that for the first time in recorded human history, the leading cause of death for teenage girls, ages 14 to 19, our teenage girls, is no longer, in recent years, has no longer been childbirth or infectious diseases. It has been suicide. And there are a lot of reasons for that. We can get into it maybe in the Q&A. But I felt like every one of those girls was calling out to me. And I think, make no mistake, they're calling out to all of us. And they were saying, where's the anger? Where's the outrage? Where's the indignation? And more importantly, where's the leadership to put this on the agenda where it belongs and get it resourced and solve it? And so I went back to Dr. Husseini Manji and I said, okay, I get it. This is not a part-time thing. This is the biggest challenge there is. And so we went to our senior leadership. We created a position of the mental health ambassador, and we started what we call the global campaign for mental health. We would try to put our company into the fight for the transfer of mental health care worldwide for our employees and our communities and our families. And you're going to hear from our panelists about some of the best practices today in bringing this movement to your workplace and your communities. I want to touch on a few things we've done and maybe provide a little bit of a guide for how you can start thinking about what you can do to be involved and help move this along. So the first thing that we did is we went to all of our senior leaders in our company. And something really unexpected happened. Almost every single one of these senior executives got up and closed the office door. Now, this was before COVID, so we were all in the office. Closed the office door and told me their personal story. And half of these seasoned senior executives wept openly. They were just the relief from being able to share their story with a colleague and to think that they might be part of some kind of a solution for their family and others. And then something completely beautiful and unexpected. Every single one of these senior leaders, every single one said, Craig, my group is already doing something about this, my department, my function, my business unit, because I know this affects my family. I know it affects, we keep seeing it among our customers and our patients and our clients. And so, we decided to do something about it, even though it was not squarely within our business plan. And so, for example, and I think you'll find this out in your own organizations. So, for example, the Johnson & Johnson Baby Company was already working globally with the leading experts on postpartum depression, which, if you read the literature, is one of the biggest impacts on child and family development. Our surgical division, we call it the med tech group, was grappling with the fact that, for example, people who need hip replacement or joint replacement surgery, knees, shoulders, half of them were never seeing a doctor because when you lose your mobility, People are more prone to lose their social connection, often lose their employment, lose their ability to do things they enjoy that keep them mentally sharp, like exercising or getting outdoors. And so they develop anxiety and depression. And that, combined with an appropriate fear of opiate addiction, meant that half of the people who we were trying to serve were not even going to see a doctor in the first place. And then our pharmaceutical vaccine division, you may have heard that we were very involved in the COVID vaccines, was working on a drug which is now approved by the FDA. It's the first new mechanism of action for the treatment of depression in about 60 years. All the existing treatments from a pharmaceutical perspective are sort of based off the Prozac biological model, but this was a new model. It's a nasal spray. It works within days for many people, not within weeks. And it works for about 70 to 80% of people rather than just a third of people like current treatments. So, and every person I talked to, whether the HR, IT, finance, philanthropy, everybody was doing something on mental health. So it turns out that my company was leading in mental health, but in a very fragmented way. And our organization, like your organization, prefers to do things at a larger scale to profoundly change the trajectory of health for humanity, or in our case. And so we started to weave those threads together and add a few more, and we launched this campaign that we would partner across the globe with other stakeholders and leaders in this space to try to transform healthcare worldwide. Now, the first thing we did after launching this campaign was completely an accident. I mean, and it was one of the best things that came out of this whole thing. We thought we were going to change the external environment. We asked our employees if they wanted to get involved. And, I thought we'd get a half a dozen people and we'd help us shape this movement and strategies and so forth. We had hundreds of volunteers. And almost every single one of them sent me an email telling me their story. And of trauma and loss and isolation and shame. And so after a few months, we decided that we needed to launch an employee resource group. So we have employee resource groups for LGBTQ, African Americans, veterans, et cetera. And so we launched an ERG for employees who live with mental illness themselves, either as a patient themselves, so that's 1 out of 4 clinically, and then a lot of us are, clinically adjacent at different times, or as employees who are caregivers like myself, and that's about 2 out of 4 employees. And this became the fastest growing new ERG in Johnson & Johnson history. After 1 year, we had 1,000 employees in 30 countries. After when I left last year, we had several thousand employees in over 50 countries. We later found out it was the first ERG of its kind. No one else had done that before. And we found out that it was very intersectional. Each of the other communities had serious mental health challenges they had not known how to address. And so we were able to partner right away. And we were able to get leadership from those groups to come over and help us accelerate the growth and transition of this new ERG. Our LGBTQ colleagues were struggling with bullying and suicide. Our veteran community struggles with PTSD and suicide. Our Asian and African American community, African ancestry, ours is a global group, struggle with trauma and also with suicide. So there was a lot of commonality. We then, so now we had more people on the team and more energy behind this effort. And we've spent the last couple of years focusing on 3 areas. And again, I'm sharing these so that you can understand where you might pick up or continue your efforts in this space. The first area is trying to attack stigma. And we found no better vehicle for that than to have our ERG members tell their own stories. So we trained people how to do TED Talks and how to tell a mental health story in a safe and effective way, not dealing entirely with the horror of your experience, but also talking about the hope that comes with treatment and community and so forth. We also have provided training to all of our people managers so that if you have an issue, and this is basically mental health first aid training, which is available globally, so that if you have a conversation with your boss, you get the appropriate support and response, just like you would if you had cancer or diabetes or COVID. You get the support you need, you take the time you need, you come back to the job you've earned. Now we know, like that if all of our employees who need the help stood up tomorrow, the system's not ready to handle that demand. So we went out and started our ERG members are called mental health diplomats, and we started going to other organizations, government employers, nonprofit employers, private sector employers, and helping them set up ERGs. We also we also partner with advocates around the world to create a global capability. And I'm delighted to tell you that today there are a couple of global advocacy groups that didn't exist before. One of them is United for Global Mental Health. So we've tried to address stigma. Now we know, especially here in the United States, and especially with our recent discussions around systemic racism, that you can raise all the awareness you want, but if you don't change the system wins every time. And so we have tried to make systemic change. Inside the company, we created a group that didn't exist before of people who wake up every morning trying to improve the mental health journey of our employees, their families, and our communities. Our ERG is now part of a global coalition under the umbrella of an informal grouping, Mind Share Partners. I encourage you to look that group up as well. And we are working with stakeholders, political leaders in every country. This is every country has different health systems, so you got to do it country by country. And then we also are pooling our purchasing power with other health plans, union health plans, private sector health plans, government health plans, to demand from payers and from the health system that they deliver affordable, quality-based care. The last thing we're working on is the science, and for us, that's the biological science, but for you, it might be the science of communications or political science or the science of financial systems. We need help in all these dimensions to move the dial on mental health. And I want to just mention one final anecdote that sort of brings these three things together: stigma, system, and science. So, we like you, we recruit from universities and high schools around the world. And these students are growing up in online communities and in school systems where they're more open about mental health than any time in history. And they are very concerned that when they go into the work world, they're going to have to go back in the closet. So we have started to recruit people like we do the LGBTQ community, the African American community, recruit women and other communities. And we say, look, come to J&J and you can be your authentic self if you or your family live with mental illness. And you can be part of this movement that we're creating internally and externally. But don't come just because you think this is the only place where you can be safe. We want you to come to Johnson & Johnson because you're the kind of leaders we're looking for. If you live with mental illness in your family, you have the leadership qualities we're looking for. We're looking for servant leaders. And servant leaders have 4 qualities. They have humility. And if you live with mental illness, you know you're not perfect. They have empathy for others. And if you live with mental illness, you know pain and you can recognize in others, you can communicate and support and help move along. Servant leaders are open to collaborating and innovating and creating new things. And if you've lived with mental illness, you've had to hack the healthcare system. You've had to hack your family and community unconscious biases. And in many cases, you've actually had to hack your own mind. And so we're pretty confident you can handle any challenge that comes to you and help build a team around it. And finally, servant leaders have grit. And if you have been through a mental health journey, Grit is your middle name. So come to J&J, be the leader we're looking for, and maybe one day be that first CEO of a Fortune 100 company who talks about their own mental health challenge. Now, we've come a long way, all of us together, and we got a long way to go. We're trying to create massive culture change, trying to create cultures of inclusion for neurodiversity, trying to end stigma. We're also trying to create massive system change, trying to provide access to affordable evidence-based care, and also to advance the research and the science across the spectrum. But every disease has a turning point. We saw this with COVID recently. We saw this with HIV in the last couple of decades. We turned that from a death sentence to a chronic illness. And with vaccines, we might soon turn HIV into a preventable illness. And we've seen, every movement has a turning point. We've seen this with marriage equality. I think hope we're seeing this with climate change. And I feel, I think there's a lot of evidence that we are moving through that turning point with mental health. I think we're in this mental health moment. And so we can begin to work together to share our understanding that mental illness, is very common. It's really just part of the human condition. It's nothing to be ashamed of. And I'd like to take a moment here to invite you to take a small step toward that future by answering a simple question in the poll here. And the question is, it's a yes or no question. Have you or someone you love had an experience with mental illness, struggle with mental illness? And as you take a moment to answer this poll, I've asked this question in high-rise, skyscrapers in Tokyo, London, New York. I've asked it in villages in India and Ethiopia and Latin America. And we see a pattern. And I'm curious to see with this group of 600 people, I'm told we have up to 15 countries represented here. And if we can close out the poll momentarily, we'll see what we have here in our group. And thank you for being open and sharing your perspective. Okay, this is exactly what I see in the smallest village, the biggest skyscraper. 98% of us have been touched by this. So look, we can start to bring casseroles, as we say in the United States, or you might call it a dinner or a plate somewhere else, to your friends when they're having a mental health crisis, just like you do when somebody has cancer or the flu. And if we could get rid of the panel picture, that'd be nice. So bring people, just like if they have a heart attack or cancer or the flu. We can start demanding, like we do for other health conditions, that we get treatment early. We don't wait till there's a crisis. No one waits until cancer is stage 4 if they can avoid it. And yet that's pretty much how we handle mental illness now. We can also demand that our primary care providers get involved in mental health support, become knowledgeable. We need to start teaching our children who are on the front lines of this epidemic as much about their mental health as we teach them now about their dental health. And we need to spread the understanding that if you have a mental illness or a mental health struggle, it's not because you're weak in character. It's not about character at all. It's about chemistry, and it's about coming together as a community to support one another. So on the 5th anniversary of that phone call, my family marked the occasion by going to a sacred place. We hiked up the Inca Trail in Peru, and we went up over the Sun Gate and down into Machu Picchu. And the world that I'm trying to create, that I think we're all trying to create, is a world where everybody can do what I did. I got to hug my daughter. I'm hoping you're seeing a picture of her now. There she is. She survived that suicide attempt and other struggles. She just is about 1.5 years sober now, which has been very helpful. She's been working towards a master's in social work so that she can help make sure that no one else has to go through what she went through, what we went through. And Catherine and I would like to invite you to join this movement. I know many of you are already in it, but now in this mental health moment, it's time to really step up our engagement and our commitment. And together we can answer the call of history on mental health. Thank you very much.
Thanks you so much, Craig. If you can stop sharing, I appreciate it. You know, I think one of the remarks you made that I hadn't given much thought to was mental health and mental illness being the only chronic condition affecting our youth. I think that's a powerful statement, one we don't normally talk about. It's important to be vulnerable and transparent. And in my introduction, I should have included that I am an individual who experiences generalized anxiety disorder, and at times it has been my greatest strength, and at other times it has been certainly an impediment on me moving forward with my life. And so with that, I'm honored to introduce our panelists today as well. For Taylor and Richard, if we can keep remarks brief so that we have time for Q&A. There's already a fair amount of questions in Q&A. We'd appreciate it. Taylor Adams is Mental Health America's Director of Workplace Mental Health, who spearheads their efforts on its Bell Seal for Workplace Mental Health National Employer Recognition Program and its annual Mind the Workplace reports. Her previous work was focused on suicide prevention, and she brings this experience to support companies in evaluating and refining policies to support staff in their mental health journey. So thanks, Taylor, for joining us for the third consecutive year on this conversation. Would love to hear a little bit more about your work and what Mental Health America is doing in the workplace mental health space.
Yeah, absolutely. I'm always happy to be a part of this event. So just for reference, I am a white female. I use she, her pronouns. I'm wearing a green top today, and I've got my light brown hair up in a bun. I will say my my thoughts are a little bit disjointed today. I just came back from a amazing 2-week international trip, the first one since before the pandemic. Which highly recommend that self-care to take vacation if you are able. But the downside is I'm still on European time and I've been up since 3 a.m. So just asking everyone to bear with me. One of the things that I wanted to ask, and this is something that if you wanted to share it in the chat, I'd love to, I read everyone's little comments there, but what brings you here today? You chose to register for a webinar focused on workplace mental health. Receiving credits, or if your supervisor just asks you to do it, is a totally fair answer as well. But I wanted to share a little bit about why this work is so important to me as a mental health advocate, as a professional, personally. But I've been with Mental Health America for 6 years now. And one, really strong reason that keeps me there and keeps me loyal and excited about the work that we do is how the culture, the benefits, the people that I work with create an environment where I feel safe to talk openly about my mental health concerns, things I'm dealing with my family, balancing work and life priorities. I'm someone who lives with depression, anxiety, and PTSD. I'm also the survivor of suicide loss. So, I've spent a lot of time in treatment and also my professional career in thinking about these things, especially in this workplace context. Craig, really appreciate you sharing your story and being so vulnerable. But you did mention something that made me laugh, is that your first job was at McDonald's. That was actually my first job at the age of 17. It was at a time that I was kind of grappling with my own personal mental health issues and just, you're kind of finding your sense of identity at that time. And I will have to say it wasn't a good experience. They often broke, minor labor laws. I was 17 at the time, so there are certain restrictions with timing. And just like I work as an advocate now for Mental Health America, I also was an advocate then, in that I would write articles for my high school newspaper saying like, know your rights as a student worker, and how can you balance having a part-time job and school at the same time. And it wasn't until years after the fact that I've gotten to this work that I'm like, wow, it's really come full circle. So with that, I just want to reinforce some of the things that Craig had mentioned and set the stage of what we're seeing in terms of workplace mental health. Historically, and I would say there's been a positive shift in recent years, especially, experiencing the pandemic. Rates of mental health conditions and stressors are up, but the way that we're approaching it is a bit different. Historically, workplaces have addressed mental health and mental illness in the workplace by reacting to incidents that happen. When I first started this position, I got a lot of calls from companies where they had just experienced maybe the loss of a coworker to suicide. Maybe there was an emergency or crisis incident that had occurred, and that was super common. There really wasn't any prevention, early intervention, open conversation about mental health at that time. And at worst, it made conditions not great for those who do live with mental health or substance use conditions. And also, policies are often crafted to protect the organization as a whole and not necessarily the individual. So when you have an organization that leads with reactive policy, or maybe that organization first approach, it's going to have an impact on your workforce, on their mental health, on the environment in general. So one of the things at Mental Health America that's really important to us is making sure we focus on prevention, early intervention. And I did see someone in the comments mention the difference there, where it's like you've got 1 in 4 or 5 individuals who live with mental health condition, and then you have 5 in 5 who have mental health. So we want to think about how we can balance that, right? How are we addressing the concerns of those living with mental health conditions in the workplace, but also just promoting a culture of well-being and wellness. And I can go and share all the different numbers of investing more money into this and prioritizing this has a better return. I'm sure you've seen some of those stats and truly stand behind that. But one of the things I wanted to add is that, and I think we'll talk a little bit about this with our panelist, is that we're really seeing a shift in the way that we think about these things. I don't know if these are the most recent numbers, but it's like 35% of our workforce is made up of millennials, 5% is made up of Gen Z. That might be higher now, but a big part of our workforce now. And I look at it from that generational perspective because that seems to be the two that are a little bit more outspoken and about mental health, are coming into the workplace with those expectations that employers are kind of considering these different factors. But with that said, and I can kind of wrap it up here. In the 6 years I've done this, the thing that I know for sure, and I've seen over and over again, is that dimensions of identity, so whether that's generational, age, organizational level, background, is going to have an impact on the way that you experience life at work. It's going to have an impact on your mental health. We put out a recent survey that looked at some of the dimensions of identity and how that is influencing your mental health at work. Haven't finalized the results on that, but there's one thing that's true, is that workplaces need to consider the individual and all the aspects of them. And Craig talked a lot about the employee resource groups that focused on different types of populations. So I think that's just aligns really well with what we're seeing in the mental health advocacy side of things as well. So with that, I'll turn it back to you, David.
Thanks so much, Taylor. Really appreciate it. We will be sharing some resources from Mental Health America as follow-up to this presentation. So some reports with some of those statistics that Craig was talking about, as well as they have a really great how to share your mental health story resource that I've shared quite frequently with leaders about if you're choosing to talk about mental health, some tips and tools for how to do that. But with that, I want to make sure to introduce our third speaker of the day, Richard Taylor. Richard is a mental health expert and has created an impact over the past decade as a powerful leader and mental health advocate for people around the world. Richard's a graduate of Northern Illinois University and obtained his Bachelor of Arts degree in Corporate and Organizational Communications. Richard is the founder of Tailor Made Empowerment, a parent company that oversees his brand, publishing, and several consulting ventures for corporate clients. He's a self-published author of 7 books and hosts a global podcast as well. Richard serves on the board of directors for NAMI, the National Alliance on Mental Illness, Eastside in Washington State. So thank you, Richard, for joining us today and providing your perspective that mental health impacts us all differently based on our background.
Absolutely. Thank you, David, and good afternoon, everyone. I know that we don't have a ton of time, so I'm not going to belabor here. I want to just say thank you for that intro. I definitely appreciate it. David, for me, thank you, Taylor, and thank you, Craig, as well, for sharing your stories. And I think that's one of the synergistic things that we have going here is that today's conversation comes from people with experience. So for me, it's no different. I was born and raised in Chicago, Illinois. Around the age of 10, I started dealing with bullying. And from 10 to 20, I dealt with depression, anxiety, and a multitude of suicide attempts. My final one at the age of 20, almost taking my life. I ended up being rushed into the hospital where a doctor was cleaning me up and letting me know that I tapped the main vessel at the top of my wrist, but no blood would come out. His next words to me were, "You've got a purpose in life and you need to figure out what it is." And so for me, little did he know that purpose was the very thing that I had struggled with for so long. And during the time of dealing with the depression, the anxiety, and the suicide attempts, everything just kind of went downhill for me. I opened up my life to a ton of different things. I gained 170 pounds in about span of 18 months from August of 2006 to January of 2008. And during that time, I was a freshman and sophomore in college. And I also found myself failing in school for about 3 semesters straight, almost being academically dismissed. And then you couple that with the fact that I got into a relationship where I was the victim of domestic abuse for that 1.5 years as well. So that was kind of like the bubbling up from everything that I never talked about. And of course, I love it, Juan. I saw you in the comment section talking about some of the cultural stigmas that we have. It was the same for me. In the Black household, we were taught what happens in this house stays in this house, that this was a white person's problem. I grew up in the church as well. So we were told you're not praying hard enough. You're not close enough to God. My granddad was the son of slaves from Possum Trot, Mississippi. And the conversation around what our ancestors had to go through and how it was compared to our struggles essentially kept me muzzled. And so my culmination of all of this came from that final attempt. But that final attempt with me in my lowest place was actually the best space that I could be, because it gave me an opportunity to receive an outpouring of love from so many individuals. I was a highly scouted football player going into college, so I was pretty well known. And in that, I did not realize that for so long, with me not wanting to be here, just how much I was loved and appreciated. I felt like I did not matter. And so that was really the shift for me. I get an opportunity to not only have the conversation, I believe conversation is great. My focus is mobility. How can we start helping folks to mobilize when it comes to best practices and ways to transition with our struggles, with where we are? David, Craig, I love the fact that in your keynote, you mentioned this concept of we all have a mental health. That's actually one of the chapters from my latest book. And I've been pushing that heavily because I'm all about the health and wellness. While the illnesses are real, I believe that we can start to help each other, our communities, and those that we serve thrive in a greater capacity as we start to take a deeper outpour into the wellness aspect of it. So thank you for saying that. There were 3 things that I wanted to leave you all with as I get ready to close here when we're talking about employee mental health and wellness, specifically from the BIPOC space, right? As I get a chance to work with a lot of corporations on the back end, doing consulting and coming in speaking, there were 3 things that really stuck out to me that I think we can all take from today. As we are in our environment, specifically for those of us who are managers in spaces of leadership, the first thing I want us to consider is, what would it look like to build leaders who are committed to understanding the complex experiences of BIPOC employees, right? The same way that we all have a mental health, we all carry different experiences that create the temperature of where our mental health is during our lifespan, right? And so I believe that it's so important for us to make sure that we're mindful of that. The second component that I want to leave us with is making sure to take the time to understand the stressors that are unique to BIPOC employees. And actually, I want to backtrack real quick. With that first point, Mental Health of America did their, I believe it was their 2022 State of Mental Health, and it showed that about 60% of BIPOC employees did not believe that their companies or employers were invested into developing supportive or understanding managers, right? And so I think it's important for us to make sure that we are being proactive rather than reactive, and one of the ways we can do that is by taking time to build leadership up in a different way that is more about the heart to heart and the human to human. Back to that second component, though, I want us to take time to understand unique stressors, right? Because of the fact that our experiences look different, I think that it's important for us to make sure that we're not immediately categorizing the experiences of BIPOC employees with our own thinking that, oh, we all go through the same thing or we deal with it in the same manner. That's not the case. And then finally, I want us to make sure that we're taking the time to get comfortable practicing vulnerability. This is so important, right? One of the things that I have seen that has been probably one of the greatest areas of transformation and betterment for the mental health of not only employees. I get an opportunity to work with a lot of youth around our country and the world as well. And there is something so special about being able, as a leader in these spaces with your employees, with those that you serve, being vulnerable. Instead of them looking at you as this hierarching figure, they get a chance to see the human in you. And whether you know it or not, that can actually start to break up a lot of the hollow ground that we have in times where our employees are going through, our coworkers are going through, and we don't necessarily know it, right? Sometimes when we talk about awareness, part of the awareness is looking at what it is that we're bringing to the table that will cause us to be more aware of the individuals around us. So I just want to leave us with those three things. I know that we're short on time, so I will stop here. Thank you all so much. And David, I want to say a special thank you as well for having us here today.
Thank you so much, Richard. You are right that we're not going to get to all the questions in the next 6 or 7 minutes. So we're going to try and do this sort of in a rapid manner with question and answer. And Taylor and Craig, if you're still available, happy to have you join us back for the Q&A section. But I'm going to start with you, Richard, with a question that came up in the Q&A, which is that there is a lot of ongoing misinformation and community taboos on mental health with a variety of race, ethnicity, and other groups. Do you have any suggestions on how to address or combat those, or certainly acknowledge them? What's your suggestion there? You know, this idea that not one size fits all for mental health, we've had a consistent conversation about right now, but when you're talking about specific taboos in certain communities and groups, what are some strategies there that you might think about?
Absolutely. I think that the first thing that we've got to do is be able to inspire the voices of those that relate. That's first and foremost, right? It doesn't necessarily need to be big numbers right away, but when we can connect to individuals who are first and foremost ready for a change and then also have been living in silence, what it does is that it starts to kind of build up, let's say for the sake of words, an army, right? Individuals who can go out, and what it does is we get an opportunity to see that, oh, wow, these aren't just, you know, sporadic incidences, but individuals are connected. But the vulnerability piece, I think, plays a huge part in the sharing as well, because of the fact that a lot of times we can start to break stigma by being able to open and share. And the individuals who don't believe, the more that they see people that they're connected to going through these struggles or being able to speak up about it, it really does kind of start to shift the mindset and the mind frame around, wow, maybe what I was told in good intention wasn't necessarily the truth, but now that I'm hearing these lived experiences, it might even cause folks to start looking at their own lives and reconsidering some of their own experience. Maybe what they thought was normal, or as dysfunction really wasn't, right? I love it. Juan kind of said it earlier. We got crazy family members and we just write them off as being crazy. And that's not necessarily the case, right? Like, we need to take a deeper look. But the more that we talk, right, it's not just about being able to have the conversation, but how can we start to advocate and mobilize in sharing in our vulnerability? I think that's one of the easiest ways to do it.
Thanks, Richard. We're going to move over. Sharing the story, talking about our own experiences is a place we can all start with. Becoming an advocate, becoming passionate, and starting to become vulnerable about your own experiences is a really important place to start. And the more you start sharing your story, the more you'll find that other individuals are willing to do that as well. Craig, a lot of questions about employee resource groups, ERGs, in our Q&A, how they got started, what they look like. We only have a few minutes, but I just wonder if briefly you could just give a short summary about, I heard you say you put the call out, but then what happened after putting the call out with all of these people coming in and being interested in talking about mental health? What did that look like? And like I said, we only have a very short amount of time here. So.
Well, we've advised a lot of organizations, so I can tell you that it's nice to have senior leadership support, like a CEO or somebody up at the top of the organization who is willing to support this. But most often, it's just people in the grassroots telling their story. If you have a company newsletter or a convening where you have a chance to share your story the way that Richard did, it always, I've never seen it not work. People will come to you and say, me too, how can we do something about this? And senior leadership will come and say, this is important. This is affecting everybody in my family. It's affecting all of our other employee groups. So I would say start by telling your story. And if you want to reach out to Richard or me or Taylor for help and advice and support in that, we're happy to do that.
Thanks, Craig. Interesting question. This has come up on a number of webinars recently about the impact of AI and ChatGPT. Taylor, I'm going to put you on the spot on this one, but I'm wondering if Mental Health America is tracking at all on how AI is impacting workplace mental health or just mental health in general. Do you have any thoughts there?
Yeah, actually, we have a whole team dedicated to this space and have really embraced exploring kind of that connection between AI and how it might support or maybe not support folks with mental health concerns. I'm a little bit far removed from the team, but we are working on a couple of AI tools in partnership with, I can't remember the name of a couple different universities, but just ways to have a conversation that feels natural, because it's really difficult to get that natural human speech with AI, but using it as a tool for CBT, DBT, getting care to people, who don't typically have access to it, or there isn't enough providers. I don't know all the details of it, but I know it's something that Mental Health America, we have a lot of information on our site if you're interested in learning more about some of these specific projects and how we're looking at AI and mental health.
Thanks, Taylor. Important to note that the U.S. Surgeon General recently put out some publications on isolation and the importance of connection in this space. The Surgeon General put out a workplace mental health report at the end of 2022, and now the resources are around isolation and social connection and how important that is. And so, that's one of the things I think about in the AI space, that there's only so much that bots and technology can do. And I think with mental health, what we've tried to talk about today, and as part of this conversation, is how we humanize the conversation. So I really want to make sure I get across to people that where technology and advancements in AI can be helpful in some of this space, I think we're at a real sort of foundational and grassroots level here, that we're having personal and vulnerable conversations as people about what's going on with mental health. And we're using the AI and the tools associated with it as additional tools and resources, which is what they are. Really appreciate all of you joining us today. We never have enough time for all the questions, but I want to give a shout out to Craig and to Richard and to Taylor for speaking and your presentations today. As you wrap up, you will hopefully, as you log out, be given a link or automatically pop up a survey to provide feedback on this event. And we want to mention that our next webinar is on June 14th. This is a recurring webinar in the month of June now as well, where we talk about anti-racism, or in this case, in June, we're talking about environmental justice in the workplace. Since 2020, we have had conversations in June, somewhere around Juneteenth, about anti-racism, racism and its impact in the workplace. And in this next month section, it'll be environmental justice in the workplace. We've already had maybe many of you, 500-600 people register, and we hope that you'll register for this upcoming webinar as well. And just once again, a thank you to all the participants here on the webinar and to our speakers. We will leave the line open for a bit so that you have a chance to log out and access that survey. Again, big thanks to Craig, Taylor, and Richard for sharing your own personal stories, as well as the presentation to our network. And, my take home today is, we all have mental health, and the more that we can start talking about it with one another and talking about it in ways in the workplace that lead to additional conversations and additional supports are important. As a program, HealthLinks is here to support you and your team in your workplace. And so if you have any general questions about how to support workplace mental health, feel free to send them to our email that you've received for registering here, contact@healthlinkcertified.org. And we can either send them out to Craig, Taylor, or Richard, or we'll be able to respond to our own. So again, thank you for joining us. Every month is Mental Health Month, and we're particularly honored that we get to talk about it intentionally in the month of May. So thank you.